Okay, so we want to talk today about digestion and nutrition. And what we have to realize is that the role of the digestive system is to take the food that you eat and mechanically and chemically break it down into small enough pieces that you can load it into the bloodstream. And the only way to do that is to turn our proteins in our diet into amino acids, to turn our complex carbohydrates into simple sugars, and to turn the fat in our diet into fatty acids and glycerol. And it's in that form that we can load it into the blood, in the case of the carbohydrates and amino acids, and into the lymphatic system, in the case of the fatty acids and the glycerol, the lipid component. Okay, um, the two processes rely on each other, right? Mechanical digestion is basically the squishing, the swirling, the mixing, the mashing that that physically breaks down the food that you eat, and that provides opportunity for the enzymes that do the chemical digestion to finish the job. Okay, so the two parts need each other in order to work real well. Okay, once we absorb all the nutrients, what will happen is that the waste products will end up entering the colon, and then from there be eliminated through the rectum and the anus. In that region of the digestive system are bacteria. Uh, an example would be E. coli that actually eat our waste products, produce energy for themselves, and produce byproducts that we use, such as the B vitamins and vitamin K. Okay, the process of digestion basically involves a tube that runs from your oral cavity to your anus. So really, all your life, even though you haven't realized it, you've been a walking donut, right? The stuff that you eat really isn't inside your body until it's in your bloodstream. And so, in a sense, your waste products are never really inside your body. They're just passing through the middle. Digestion begins in the oral cavity where we have the teeth, tongue, the salivary glands, and the hard and soft palate. The job here is to mechanically break down the food by chewing, right? But also chemical digestion happens because the salivary glands, you can see some here and here and here under your jaw, in front of your ear, and under your tongue, um, produce a secretion, saliva, that contains enzymes which begin the process of breaking down lipids and starch. Okay, and what will happen next is that you'll swallow. Okay, skeletal muscle, which you control, all right, will push the food from your oral cavity into your throat, which is your pharynx. From your pharynx, the food will enter your esophagus through a doorway called the upper esophageal sphincter. And the esophagus is simply a tube that connects your throat to your stomach. Okay, the upper esophageal sphincter is made of skeletal muscle, which you consciously control. Okay, and then smooth muscle pushes the food the rest of the way down to the stomach. Smooth muscle is a type of muscle tissue that works without you having to think about it. Okay? And the movement that pushes it down towards the stomach is called peristalsis. And this is a type of movement that happens all throughout the digestive tract. Once we make it to the end of the esophagus, there's an opening into this organ, the stomach, called the cardiac sphincter. That's smooth muscle, and that'll let the the wet food ball, the bolus, into the stomach where gastric juice that the stomach makes will liquefy it, and the stomach will churn that mixture, okay, into a liquid that's called chyme. Okay, so the bolus, the food ball, drops down into the stomach, and the gastric juice turns it into chyme. All right. Gastric juice contains powerful acids and enzymes that break down protein. Okay, and then in very short squirts, okay, the stomach will shoot that liquid, that chyme, into the small intestine. The small intestine is where most of the nutrient absorption takes place. At the same time that that happens, an organ called the pancreas, which you can kind of see tucked back here, and an organ called the gallbladder will squirt liquid into the small intestine. The green liquid from the gallbladder is called bile, which is made by the liver, and the liquid that comes from the pancreas is called pancreatic juice. Okay, the bile is basically a detergent that helps to mechanically break down the fat in our diet in a process called emulsification. while the pancreatic juice contains bicarbonate as well as digestive enzymes. The bicarbonate neutralizes the stomach acid in the chyme, and the digestive enzymes continue the process of breaking down our proteins and our carbohydrates and our lipids. Okay. Um, then we're going to move through the small intestine, and as we do, we're going to continue the chemical and mechanical breakdown process and remove all the nutrients from the food that we eat and load them into either the blood or the lymph. Okay? And then by the time we get to the last part of the small intestine, which is called the ileum, and we get to what we call the ileocecal valve, which is a doorway that opens from the ileum into the large intestine, all the nutrients have been removed from this material in the pipe, and the waste products can enter through the ileocecal valve into the cecum, this little pouch, then go from there to the ascending, then to the transverse, and then to the descending and sigmoid colon, and then out the rectum and the anus. Okay? While in the large intestine, the fecal material is broken down by bacteria that live in the colon, and they produce byproducts that are useful, such as the B complex vitamins and vitamin K. And then a mass movement occurs, and we push the material out using our abdominal muscles as well as the action of the smooth muscle in the large intestine that aids in the mass movement. Okay? And that's called defecation. If we start in the oral cavity, the tongue is basically skeletal muscle, meaning you control it. On its surface, on its top surface, it has papillae. Those are the little rough projections, and on the sides of those papillae are the taste buds. Okay, the lingual frenulum is a piece of tissue that attaches the tongue to the bottom of the mouth, so you don't swallow your tongue. And then the oral cavity is separated from the nasal cavity by the hard and the soft palate. If we didn't do that, you would end up putting food and liquid into your nasal cavity every time you ate, and that could end up in your respiratory system and you could choke. Okay, that occasionally happens in a condition in newborns called cleft palate, where the hard palate doesn't close up completely and leaves an opening between the oral and the nasal cavity, and that has to be corrected with craniofacial surgery in order for the baby to be able to nurse. And it's thought to be linked to a lack of B vitamins in the diet of the mother in some cases. Okay. Also in the oral cavity, we've got our teeth, which are our tools for the mechanical breakdown of food, the beginning of the mechanical breakdown of food. We have 20 deciduous teeth. Deciduous teeth get their name because they fall out, just like deciduous trees drop their leaves in the fall. So you got 20 of those. Those fall out and provide your 32 adult teeth, which are in the upper and lower jaw. And the shapes of the teeth include the incisors, the cuspids, the bicuspids, and the molars. The incisors are kind of flat and have kind of a sharp edge to them, so they're for chopping. The canines have a sharp point, and they're for slashing. The bicuspids and the molars sort of have a flat surface with bumps and grooves in it, and they're for grinding. Okay, so that is the dentition of an omnivore, an animal that's supposed to eat equal parts meat, vegetables, and fruit. Okay, so that's what we call balanced diet. If we were to look at the dentition of a carnivore, we would see molars and canines and a few incisors, and they're supposed to eat raw meat only. Okay, and if we were to look at the dentition of an herbivore like a cow, we would see incisors and molars only, and they're only supposed to eat plant material. Okay, so the tools in your mouth are a way of determining what you're supposed to eat. The structure of the tooth includes a top part, which is the crown, which is covered with enamel, and then there's a neck, and then under that is the root. Okay, the gums, which are the gingiva, come into contact at the top of the neck, so they're just below the crown and just above the neck. Okay, the tooth is only covered with enamel at the crown, which is the enamel is the toughest material that's made from a biological organism, so it's real tough to basically rot through. But occasionally, what will happen if you don't do good dental hygiene, is that bacteria that live in your mouth can feed off the food you eat after you swallow, and when they do, they set up camp on the enamel of your teeth, forming something called plaque, and the acids in the plaque can eat away at the enamel, and then if we get through the enamel and into the deeper part of the tooth, which is made of something called dentin, then we can take a quick trip to the pulp cavity and the root canal, and that's where nerves and blood vessels are at, and that can end up having bacteria in your bloodstream, and that can, in some cases, be lethal. Okay, so if that occurs, we have to pull the tooth and replace it with a post or eventually a crown. Okay, um, the the neck and the root are not covered with enamel; they're covered with something called cementum, which is much softer than the enamel is. Okay, we've talked about caries, cavities, and what causes them. In the event that the bacteria get into the crevice between the gums, also known as the gingiva, and the tooth, and that area is called the gingival sulcus, okay, then they can cause the gums to get irritated and bleed when you floss, and that's a condition called gingivitis. And if you continue not to have good dental hygiene, that can lead to periodontal disease, periodontitis, where the gums actually recede, the tooth gets loose in its socket, and it can eventually cause the teeth to fall out, right? And so the treatment for advanced periodontal disease is to scrape the gums and pull all your teeth, and then we give you your third set of teeth, which you know better as your dentures, okay? You can see what a tooth looks like here. You can see the incisors, the canines, right? The molars and premolars, right? This third molar back here is called your wisdom tooth, and we talked in class a little bit how sometimes your wisdom teeth, when they come in, they don't come in straight. They have to be pulled, and an oral surgeon does that by knocking you out, slicing the gum where the tooth is, and then extracting it with what are basically a pair of pliers, okay? And that's why when you recover after they stitch your gum shut, they give you Percocet, and they recommend rest ice compression in order to reduce inflammation, okay, so that the area of the surgery can heal more quickly, all right? And we also talked about the fact that the third molars are basically a leftover characteristic from early in evolution when we had a diet that was way higher in plant material, and we needed the extra molar in order to mechanically break that down, okay? Our oral cavity was much bigger back then, and what's happened over time is that this is a trait that is basically disappearing from the human population. Not everybody is born with all their wisdom teeth, okay? So eventually we won't have them anymore. You can see the tooth here, right? There's the crown. Beneath that is the dentin, right? This is the cementum, right? These are what are called periodontal ligaments. They just hold the tooth in place in the socket in your jaw, right? There's your root canal, and there's your pulp cavity. See all the nerves and the blood vessels in there, okay? So this is why if the bacteria go under the enamel here, that's the gingival sulcus right there, that little crevice, they can get up and under real quick, and they can go into the pulp cavity, and that can be a real problem, okay? We talked about the fact that in the oral cavity, um, saliva from the salivary glands begins the process of chemical digestion because the amylase in the saliva starts to break down starch. Um, it also lubricates the food, okay, and it also contains antibacterial components that keep um, pathogens from growing in the oral cavity, as well as the bacteria that cause dental caries. Okay, so those are called antimicrobials. Okay, an example of one is lysozyme. You don't need to know the different parts of the pharynx. Okay, I just wanted you to know that the pharynx is your throat, and that lies between your oral cavity and your esophagus. Okay. In addition, you also have in your oral cavity and in your pharynx structures that are called tonsils, okay? And what tonsils do is they trap pathogens before they get into the digestive system, and then white blood cells that live in the tonsils kill them before they get a chance to cause disease. Sometimes the tonsils lose the battle with the bacteria, and they have to be removed, and that process is called a tonsillectomy, okay? And that's a surgical procedure. You can see here an example of what swallowing looks like, okay? When you swallow, Skeletal muscle is going to be involved in the first part of swallowing that pushes the food past the hard and the soft palate and into the pharynx. Okay, skeletal muscle also pushes the food towards the upper esophageal sphincter. It also helps to close the epiglottis, which is a flap that protects your voice box and your trachea from getting food in it when you swallow. And at the same time, your soft palate is going to block the upper part of your throat, which is called your nasopharynx, and that way you don't get food up in your nasal cavity. And then what will happen is that skeletal muscle will push that material through the upper esophageal sphincter, the opening to the esophagus, and then smooth muscle takes over and pushes it down the esophagus towards your stomach, where the cardiac sphincter, which is the doorway into the stomach, will open up and let the bolus in. Okay, this area of wet food here, that's called the bolus. Okay. So swallowing begins with the voluntary phase, and then reflexes take over once it's pushed back into the throat. Skeletal muscle is involved up until you get into the esophagus, and then smooth muscle takes over, right? Just remember, skeletal muscle we consciously control, and smooth muscle we don't, okay? That's just a look at what the digestive tract looks like. What I want you to understand about it is that it's made up of layers that do different jobs, okay? The innermost layer's job is to produce mucus, which helps to lubricate the pipe and also traps pathogens so they have a tougher time getting into the blood, okay? And then there's also in the small intestine enzymes on this innermost layer that help to chemically break down the food that we eat, okay? And then underneath that there's connective tissue, okay? Just know that it's a type of tissue that glues other tissues together, and in the connective tissue are white blood cells that guard against pathogens getting into the blood. And then underneath the connective tissue is muscle, smooth muscle, that helps to push the food through the pipe, okay? So this is what does the peristalsis, okay? And then there's generally an outer layer that latches the pipe to the surrounding structures so it doesn't twist, buckle, or kink, okay? And that's the definition of an organ, different tissues doing something together that a single tissue can't, okay? So that esophagus that comes after the throat runs from the pharynx to the stomach, and it's peristalsis that pushes the food through the cardiac sphincter and into the stomach, okay? The esophageal sphincter is the lower esophageal sphincter is the entrance into the stomach, and it is basically a ring of smooth muscle that closes once the stomach has received the food to keep the gastric juice from refluxing back into the esophagus where it would damage it. Okay, that's a look at how peristalsis works. You can see how smooth muscle contractions push the bolus towards the cardiac sphincter where the stomach will receive it. Okay, this happens without us having to think about it. It's just automatic. Okay, in fact, most of the digestive system works on autopilot. Okay, without us having to think about how to make it function to do its job, and that's because it has its own nervous system, okay, that helps it do its work, and it also is controlled by a division of the nervous system that we don't consciously operate, called the autonomic nervous system. Okay, so the two nervous systems, the enteric nervous system and the autonomic nervous system, you don't have to think about them to get them to run. Okay, and that's why somebody who's in a wheelchair can still digest their food, okay, because basically the digestive system can run itself. The stomach is simply a chamber that receives the food from the esophagus. It has ridges on its inner lining called rugae that disappear as the stomach fills up. So the purpose of the rugae is to let the stomach stretch out. The stomach allows us to do discontinuous feeding, meaning that we can eat a meal and then be done with that and then carry on our life. Okay, if we didn't have a stomach, we would have to be eating all the time. And I think I gave the example of an earthworm who doesn't have a stomach. Their whole life consists of eating, pooping, and making baby earthworms, and it's all because they don't have a stomach. Okay. The stomach liquefies the food. It turns the bolus into chyme. It continues the chemical breakdown of protein because it produces enzymes that break the protein down. Okay. And it also moves that liquid into the small intestine. It also sterilizes the food because of the production of stomach acid. Okay, that's one of the two main purposes of stomach acid, um, to sterilize the food, and the other purpose is to help the chemical breakdown of the food. You can see what the stomach looks like here, and again, it's just really part of the pipe. It runs from your mouth to your anus. Um, it has the same basic layers, but it has a little more smooth muscle than the rest of the tract because it has to do a churning action in order to liquefy the bolus, and that's smooth muscle again. And then it has an inner layer that produces the stomach acid and the mucus that protects the stomach from its own acid. The inner layer also makes the enzyme that breaks down protein. And then this outer layer here latches the stomach on to the rest of the body chamber, and it also lubricates the outside of the stomach so that when it does its churning action, it doesn't damage itself too much. Okay, and you can see there's a lot of blood vessels going to and from the stomach. There is some material that gets absorbed in the stomach when we eat it, like alcohol and other non-polar things that we consume. Certain medications can go directly across the lining of the stomach and into the blood. Okay. Um, Essentially, once we liquefy the food, we're ready to send it on into the small intestine. Okay, this takes about 2 to 6 hours to produce chyme from the food that we eat. That's the liquid that results once the bolus has been completely chemically and physically broken down in the stomach. And then in little squirts, it'll enter the first part of the small intestine through the pyloric sphincter, which is the doorway out of the stomach, into an area that's called the duodenum, which is the first part of the small intestine. Okay, the small intestine runs from the pyloric sphincter to the ileocecal valve. The pyloric sphincter is the doorway out of the stomach and into the small intestine, and the ileocecal valve is the doorway out of the small intestine and into the colon. Okay, it's about 18 feet long, so it's pretty long. Again, if we divide that by 3, right? That's going to be 6 yards, right? That's a pretty long piece of pipe that's already inside your body, and the reason it fits in there is because it's been folded on itself pretty extensively. We should also point out that the inner surface of the small intestine has ridges and finger-like extensions on it that also increase the surface area so that the absorption of the nutrients is easier to do in a tinier volume. Okay, the 3 parts of the small intestine are here. You don't need to know each part. Just know that the small intestine is between the stomach and the large intestine. Okay, you can see the 3 parts of the small intestine here, right? The duodenum, which is the shortest part of the pipe, and then we got the jejunum, and then finally the longest part of the pipe, which is the ileum. Okay, and then there's the ileocecal valve. There's where the waste products enter the colon once the nutrients have been removed from them in the small intestine. Okay, we talked about the fact that the small intestine is increased surface area because of the presence of circular folds and villi. The idea again behind this is to allow the process of absorption to happen in a tiny volume. Okay, remember that the amino acids and the monosaccharides and the water-soluble vitamins and the minerals go into the bloodstream across the lining of the intestine, whereas the fats go into the lymphatic system, and the structure that picks that up is called a lacteal, right? And then in the lymphatic system, eventually that material will get back to the blood at a blood vessel near your shoulder called the subclavian vein. Okay, you can see what the lining of the small intestine looks like. Okay, and I just want you to know that it's got a lot of surface area for absorption. Okay, you can see the ridges in the grooves. You can see the villi here, right? And you can see the blood vessels, and that little guy there is the lacteal, right? And so the goodies, once they're produced in the pipe, are going to go either into the blood or they're going to go into the lymph, and then from there they'll eventually make it to the liver, and then the liver is going to either store that stuff for later as fat or glycogen, or it'll release it into the blood so that the body can use it right away. Okay, and that's what the pipe looks like under the microscope, and that's at a bigger magnification, right? These little guys here are called microvilli, and they're just um, little teeny tiny extensions that are actually on the cells that line the villi, and so that increases the surface area even more. Okay. Um, the digestive system is important for the breakdown of fats, proteins, and carbohydrates into a form that you can load into the blood. The way this happens is that the bile that's made by the liver and concentrated in the gallbladder helps to emulsify the fat so that the enzyme lipase has an easier time of breaking it down so that it can be absorbed into the lacteals of the lymphatic system. And then the other enzymes that break down the carbohydrates and the amino acids, which are produced by the pancreas as well as lining the small intestine, finish the job of generating the amino acids and the monosaccharides so they can get loaded into the blood. Okay? And so that's exactly what's happening here. We should also point out that segmentation helps mix the chyme with the enzymes and the mucus in the intestine. And segmentation is just little constrictions along the pipe so that when the liquid moves from a big part of the pipe to a narrower part of the pipe, it kind of squirts through, and when it does, it kind of mixes with the stuff around it, and that helps chemical digestion and absorption. Okay, and we've already talked about what the peristalsis is doing. Okay, again, the only reason I'm showing you this is so that you understand that the digestive system could operate without you having to consciously control it once you swallow. Okay, the nervous system has its the digestive system has its own nervous system called the enteric nervous system that operates within that body system, but it is controlled by the autonomic nervous system, which is an involuntary division of the central nervous system. Okay, a functional division. Um, so you don't have to think about the process of digestion at all. All right, once you swallow, that's the end of the voluntary part, really, until you get to defecation. Okay, what goes on in between there, you don't have to think about one bit. Right, it's all on autopilot. Okay, the three phases of digestion: the cephalic phase, where the idea of food stimulates secretions that are going to help break the food down; the gastric phase, where it enters and stretches out the stomach, okay, um, and the intestinal phase, where it enters the small intestine, okay. And the idea behind these different parts is that once we pass into a certain area of the digestive system and then out of it, we don't want that process that happened when we came in to continue, because there's no point to it, right? As an example, once food has left the stomach and has entered the intestine, we don't need to keep making gastric juice because we've already taken care of the food, right? So we will cause the production of gastric juice to decline until the next time we eat or think we're going to eat food, okay? In the intestinal phase, what happens is that we end up producing responses that are going to help us in the intestine. We make the bile and the pancreatic juice enter the small intestine at the same time that the chyme does. Okay, and then we also um, promote the, the muscle contractions that push the food through the pipe, peristalsis. Okay. The large intestine gets its name from the fact that it has a larger diameter, even though the length is shorter. The parts are the cecum, the colon, the rectum, and the anal canal, and the colon can be broken down into the ascending, transverse, descending, and sigmoid colon. Okay, and its job is to store waste products until they're going to be eliminated, but also to absorb water, salts, and vitamins that are that remain in the fecal material once it enters there from the small intestine, and in the case of the vitamins, which are manufactured by the bacteria that live in the colon. Okay, so we get their byproducts, which is very useful. Underneath the cecum is a little tiny sac called the appendix, and it can sometimes get plugged with fecal material and get blocked, and that can produce distension and pain, and that's a condition called appendicitis. Okay, the reason that happens is because the bacteria get trapped in there, make gas, and it could cause the organ to swell up and potentially blow. And if it does, fecal material gets inside the abdominal pelvic cavity, and that inflames a structure called the peritoneum, which lines the abdominal pelvic cavity. It produces a condition called peritonitis, and then from there it can get into the blood, and that's called septicemia, and that can end up killing you. Okay. If you have appendicitis, generally what you're gonna feel, okay, is intense pain midway between your belly button and the crest of your hip. Okay, and if the doctor pushes you there and you scream, you probably have appendicitis. Okay. The haustra are just little pouches that form within the large intestine as the smooth muscle kind of tries to shorten the pipe to help push the fecal material through. Um, they, they, they show up and they vanish as peristalsis takes place. And mass movements should happen about 3 times a day if everything is operating normally to push the waste material to the rectum, through the anal canal, and then out the anus. So there is the large intestine. You can see the different parts. Okay. Um, Again, to review, right? There's the appendix. There's the cecum. There's the opening from the ileocecal valve, and there's the ileum, the last part of the small intestine. From cecum, we go to ascending, then transverse, then descending, and then sigmoid colon, and then the rectum and the anus. Okay. This is what the end of the trip looks like. Okay. You can see here that the anal canal and the rectum are surrounded by 2 sphincters, an internal anal sphincter, which is made of smooth muscle, which we do not control, and an external anal sphincter made of skeletal muscle, which we do control. So if you're going to have a movement, right, go number 2, you have to open up both sphincters in order to go. Okay, this one you operate on your own, this one you do not. Now sometimes what will happen is that the fecal material sits too long in the large intestine, and we pull too much water out of it, and the result of that is a condition called constipation. And what that can lead to, in some cases, is the production of structures called hemorrhoids, which are varicose veins of the anal canal, right? So they can bulge either above or below the anal canal. If you can palpate them, if you can feel them, they're external hemorrhoids, and if you can't, they're internal hemorrhoids. And the danger with a hemorrhoid is that not only is it painful and itchy, but it can bleed. And if it bleeds, it could get infected, and if it gets infected, you could end up getting very sick and perhaps even dying. Okay, so who deals with hemorrhoids is going to be your family doctor or your proctologist. Okay, so if you feel something back there that wasn't there before, or if you see blood in your stool, okay, then you need to go talk to your GP, okay? And they will tell you what, if anything, needs to be done, okay? Your fecal material is 75% water, 25% solids, and there's bacteria and fiber in there. The colon contains bacteria that break down our fiber and produce vitamin K and B complex vitamins, which we absorb into the bloodstream, and that benefits the chemical reactions that keep us alive. So that's an example of what's called a symbiotic relationship, where both ourselves and our bacteria get a benefit from living together. Okay, you scratch my back and I'll scratch yours. Okay. Now, occasionally, what can happen is that the lower esophageal sphincter, also known as the cardiac sphincter, can get weak, and then the stomach acid and the food in the stomach can reflux into the esophagus and can irritate it and scar it, and then sometimes even eat a hole in it. Okay, and that leads to a condition called Barrett's esophagus that can lead to esophageal cancer. It can also lead to an esophageal ulcer or a perforated esophagus, okay, which is very dangerous because now you're going to be leaking food and liquid into your chest cavity, okay, and that can lead to massive infection. The risk factors include obesity, pregnancy, smoking, and old age, okay. Obesity and pregnancy, the reason is that the extra weight on the stomach can push the food in the wrong direction when you lie on your back, okay, or on your stomach. Um, the smoking and the old age basically can weaken the cardiac sphincter so it doesn't close all the way, and then the liquid flips into the esophagus, okay. The treatment is going to be proton pump inhibitors, which going to reduce acid production in the stomach. You can also take antacids, all right? And then they also recommend eating smaller, more frequent meals, all right, in order to avoid this problem. Gastric ulcer is a result of a bacterial infection from a bacteria called Helicobacter pylori, which is everywhere, it's all around us. If you inherit from your mom and dad the right kind of stomach lining, the Helicobacter can latch on to that lining and cause an infection. And then that'll inflame that area of the lining, and that produces a bleeding sore called an ulcer. And the action of the stomach acid combined with the inflammation can carve a hole right through the stomach and can puncture it, and that's called a perforated ulcer. And at that point, your gastric juice will start leaking into your abdominal pelvic cavity and start digesting your internal organs, and that's an immediate medical emergency. Okay. The treatment is antibiotics and proton pump inhibitors. Okay. Contributing factors also include drugs like aspirin and ibuprofen, and that's because they reduce the production of the mucus that protects the stomach from its own acid. Okay. We've talked about appendicitis and peritonitis, right? Why they happen and how they happen. Okay. We'll take a break now and be back at 11:50.
$10 for that computer. I got me one and my sister's one. I found all of them on Marketplace. $10.
Well, can you find me one and I'll cash up you the money?
When I send you the address, you just gotta go pick it up. You don't gotta cash out me. When I send you the address, just go get it.
Okay.
What is it?
Okay.
A printer?
I don't know. I'm old, y'all. I'm 41 years old. I don't know nothing about
You ain't old.
all that.
Don't be claiming that. You ain't old.
You're not old. I'll be 60.
That is not old.
I mean, I don't know these computer stuff though.
Mr. Converse, you
Yes,
said you gonna be
Gabby,
50?
and yes,
We 41 together, girl.
Zaire.
Wait. Everybody, we got to go through attendance again. Okay, so let's
Okay.
make one more run through it. Okay, Abina. Is Abina here?
Yeah.
Yeah, okay, good. Okay, Stephanie Beckham. Zaire Berry.
I'm here.
Good. Okay, Deja Brown.
Here.
Good. Gianna, I already got her. Courtney Little.
Here.
Good. Okay. Sherlisa, you here?
I'm here.
Good.
Yes.
Okay. Jerry Ann?
I'm here.
Good. Ebony?
I'm here.
Good. Kenya?
I'm here.
Good. Ashley? Ashley Wilcox? Okay. Justice? All right. And Ivana?
Mr. Converse,
Yes, ma'am.
when it comes to this attendance, why I say 10% if we've been here? Only missed one class, so why I say 10%?
Okay, if there's a problem, like when I called, just shoot back and let me know that I didn't hear you, and I'll correct it.
Okay.
What up? Did you get my name, Nina McCarter?
Hold on.
Yeah, he got you, Nina.
Yeah, I got you. I got you.
You ain't called me, Lamar Higgins.
Hold on. No, I got you. Hold on.
If he marked us the first time, he didn't call our names.
Oh, okay.
Yeah.
But wait a minute. Okay, I hear what your question was, Tiana, but what about, why mine don't say nothing? Why mine says 0 too?
Yes, I can't put it in the oven for y'all.
I'm here every class.
Me
Okay.
too. I ain't missed none with the grace of God.
Okay.
I missed one. I missed the second class because I was on here, but I couldn't get it. I couldn't find out where it was at.
Okay. What I'll do is I'll send an email to everybody that's got a dink on their attendance, and if you've been here every class, I'll just correct that by contacting the business office. Okay. All right. So we got all that. All right. I just sent you guys 2 links to an introduction to chemistry. All right. Very important. One is a lecture that I gave back when I was with Aunt Nellie. All right. And then another one is a link to a Khan Academy lecture on introduction to chemistry. Okay. If the chemistry stuff is confusing, watch that. And then if you still have any questions, make sure and get in contact with me with specific questions. Okay. And I can answer them for you. But it's a good idea to review that material if you're still confused. Okay. We left off, all right, with some disorders of the digestive tract. Now, this is one I'm sure that we've all experienced at some point. Constipation. Okay. I'm sure everybody at some point has been constipated, and that generally is the result of the fecal material moving through your large intestine too slowly. Now, why does that happen? Sometimes it's what you eat. Okay. If what you eat is low in fiber, you're going to tend to get constipated because the fecal material not going to hold on to its water as well. Okay. So if you're eating a lot of meat, cheese, and a lot of protein, you're going to have a very low fiber content. Okay. Another problem that leads to constipation is old age. The older we get, the slower our large intestine moves. And when that happens, the fecal material sits in there a real long time and the water gets pulled out and the stuff gets harder to pass. Okay. The fix for this is to increase your fiber content, right? So you got to get a fiber supplement or prune juice or fruit juice, or increase the amount of fruits and vegetables in your diet in order to have enough fiber in your fecal material to pull the water in and make it easier to get rid of. An example of a treatment for children with constipation back in the old days was to give them molasses. Okay. Molasses is basically, it's like a syrup. Okay. It's very tasty. And it would pass into the colon because it's got such long polysaccharide molecules in it, long complex carbohydrates in it, that it would pull water into the fecal material and make the fecal material easier to pass. Okay, so that's one example. Sometimes what happens if you get too constipated and it's very hard for you to pass the fecal material is you get hemorrhoids. All right, we talked about the danger that they represent. In some people in long-term care facilities, the constipation could get so bad that the fecal material can turn into a mineral, okay, literally a rock, and we call those fecalates, and we have to remove those in order to restore flow, okay. You maybe have heard of people sometimes having problems with constipation that result in us having to go in surgically and do something called a colostomy. Okay, sometimes what happens is that sections of the large intestine quit working, and what we have to do is bypass them. So what we do is we basically hook the working part of the large intestine up to a bag that you poop into, and it just hangs off the side of your body, right? And then in a second surgery, if we can do it, we try to reattach the working part of the large intestine to your rectum and your anus so that you can go again. Sometimes that's a permanent condition, sometimes it's a temporary bypass, okay? Diarrhea is the opposite problem, okay? In diarrhea, what happens is that the material's moving through too rapidly, and the result of that is that too much liquid is in it, and so you have bowel movements very frequently where you lose lots of water and lots of electrolytes. So the danger here is dehydration, okay? So this is really bad if you get it when you're younger or you get it when you're older, okay? And that's one of the reasons why in people that have a lot of diarrhea, we recommend, dietary recommendation is fluid intake and electrolyte intake, okay? So that we don't get so far out of whack with our water balance and our electrolyte balance that we end up having nerve problems and muscle problems. Okay, a polyp is like a little growth, okay? It's a, but it may be a benign or it may be a malignant growth. It depends, okay? A benign growth is one that won't spread throughout the rest of your body, blood or through the lymph, okay? A malignant growth will spread, okay? The problem with the polyp is that it can block the tract, okay? The other problem with the polyp is that it can, if it's malignant, end up spreading cancer to all parts of the body. And that's one of the reasons why, especially if you have a family history, that we recommend that you have a colonoscopy at least once every 3 to 4 years, okay? Where what they do is they give you some very powerful laxatives. You take those and you clear out the colon so they can see, and then they go in with a scope and then they look to see if there are any growths in there, right? So the colonoscopy is itself is painless. It's the preparation for the colonoscopy that's kind of a problem. And then they can make a recommendation if they find something as to whether it's serious enough to need surgery or whether or not we can leave it alone, okay? Diverticulosis, okay? Sometimes you can have a condition in which little pouches form along the intestine. This can either be in the large or small intestine or both. And the problem with those pouches that form is that they can catch material running through the pipe and they can get inflamed and they could potentially rupture, just like the appendix can sometimes rupture, okay? And that's what diverticulitis is, okay? Diverticulitis, you get stuff trapped in there, you end up inflaming the little sac, and the sac can potentially rupture. So what are the recommendations for people with diverticulosis and diverticulitis? High fiber, avoid food with seeds in it because they can get caught and jammed in these little sacs, okay? And the fiber is just, again, to improve the movement of the material through the pipe, okay? All right. Other organs that are important in digestion, your pancreas, okay? Your pancreas sits behind your stomach between the first part of the small intestine called the duodenum and the structure called the spleen. So it kind of runs along the back of the left side of your body underneath your diaphragm, okay, which is your breathing muscle. It has two functions, right? One function is to make a hormone called insulin, another one called glucagon, okay? Insulin is produced when our blood sugar levels go up after a meal, and it's a signal to our liver and the rest of the cells in our body to take the sugar out of the blood. For the liver, it tells the liver cells to turn that sugar into fat or into glycogen. And then for our tissue cells, other than the liver, it's removing the sugar from the blood to use for energy, okay? Glucagon has the opposite effect. When our blood sugar levels drop after a considerable time after a meal, the glucagon produced by the pancreas tells the liver to create glucose out of our fat and glycogen and release it into the blood, okay? So glucagon raises our blood sugar levels and insulin lowers them, okay? Exocrine function of the pancreas is to produce produces bicarbonate, which neutralizes our stomach acid so we don't carve a hole in the small intestine. And it also produces enzymes that help to finish the job of digesting the chyme that comes from the stomach into the small intestine, okay? So it really is two organs in one. It is an endocrine organ, and it is also an exocrine or digestive organ. You can see it here, okay? So this is your liver. Your liver's on the right side of your body under your diaphragm, okay? There's the gallbladder, which is on the back of the liver and kind of peeks out underneath it, this little crevice. Your pancreas is tucked behind your stomach. Your spleen would be over here. And this is your duodenum, the first part of your small intestine. So he's right in between these two parts. This part's called the head, and this part's called the tail, okay? And he looks a little bit like oatmeal, okay? He has a pipe called the pancreatic duct that comes and dumps right into the small intestine, and that fuses with something called the bile duct, which comes out of basically the gallbladder, okay? And so they both dump into this pipe at the same location, this little hole here, okay? And what can sometimes happen is that the bile in the gallbladder can sit too long and can crystallize, and that forms something called gallstones. And the gallstones can block sometimes the entrance of the gallbladder into the bile duct, and sometimes it can block ducts, okay? If it ends up blocking both of these ducts, then the pancreas will inflame and can sometimes digest itself, which is bad. And then sometimes it can cause the gallbladder to inflame and maybe rupture, okay? And that can lead to infection. So what we do for that is we can do surgery, or we can do something called lithotripsy, okay? And we break the stones up so that the bile and the pancreatic juice gets into the small intestine easier, okay? Dietary recommendations for people who've had their gallbladder removed is to have a low-fat, high-carbohydrate diet. That means that you don't have to produce and use as much bile, okay? The bicarbonate in the pancreatic juice is there to help help to neutralize the stomach acid, or else you would eat a hole through your small intestine. And the amylase in the pancreas breaks down the starch in our diet. These other enzymes here, you don't need to know these individual names, just know that these break down protein. They're called proteases, okay? And they help to bust the protein into tinier fragments. The lipases tear apart the fat, and the nucleases break down something called DNA and RNA, okay? We talked about pancreatitis and what can cause it, right? The inflammation of the pancreas can lead to its destruction, okay? It can be the result of gallstones. There's also problems if you use too much alcohol. Viral infections can hurt the pancreas, and that could cause the pancreas to auto-digest, okay? This is your liver. Your liver is awesome because without the liver, you would die. That's why the first four letters of the word liver spell live, okay? What does the liver do for us? Well, it cleans our blood. It makes bile. It produces fat and glycogen from the nutrients absorbed from our blood. It makes immune proteins. It also provides nutrients to the body when it carries out the breakdown of fat and glycogen, okay? And it also detoxifies the blood. So it removes pathogens and also gets rid of toxins. If if you lose all of your liver, you're going to die. But what's nice about the liver is you can lose 80% of it and it will grow back a fully functioning liver. And so that's unique, right? A lot of organs can't do that. That's called regeneration. Okay. In addition, if you need a new liver, the only thing you have to match from a donor is the blood type. And that's a condition that the liver has called immune privilege, where all we have to do is get the blood type matched, and then the donor liver tissue will take and it will regrow. Okay. The liver creates bile that's stored in the gallbladder, and the purpose of storing it there is to concentrate the bile so that it's a better detergent. And then these pipes that lead it into the liver from the back, which are the hepatic portal vein and the hepatic artery, they end up mixing blood inside the liver, and that's where the blood gets treated before it enters the inferior vena cava from the hepatic vein and goes back into the blood supply. Okay, so all you need to know is that the liver is getting blood from the digestive system, processing it, storing the nutrients from it, and then putting it back into the blood. Okay. The liver, if it gets inflamed, that's a condition called hepatitis. Okay. That's very serious. But hepatitis can be the result of drug abuse or alcohol abuse. It can also be the result of certain viruses that cause hepatitis. Okay. And basically what that does is it damages liver tissue. What can happen if the liver gets all scarred is that the blood pressure in the hepatic portal vein can get real high, and that can back up into the digestive system, and then that causes bulging blood vessels all along the digestive system, particularly in the esophagus, and that causes a condition called esophageal varices, where those bulging veins can break and bleed. This is often seen in alcoholics who drink too much, because the breakdown of a lot of alcohol creates a compound that basically kills liver tissue and makes it scar up, and that's called cirrhosis of the liver. Okay? Another condition that you'll see in people with liver disease is a yellowing of the skin and the eyes called jaundice, and that's because of the buildup of a compound called bilirubin in the skin and the eyes. Okay, and then you generally will see a swollen abdomen, and that's because the protein that the liver makes that helps the blood hold on to its fluid aren't being made as quickly, and so the blood loses its fluid to those areas in the abdominal pelvic cavity, and that's a condition called ascites. Okay, that's what we saw, for instance, in kwashiorkor and marasmus, which we'll talk about, where the diet being low in protein means you can't make the protein albumin that helps the blood hold on to its water. Okay, and it ends up with the same result, which is ascites. Okay, so those are the liver functions, right? Very important. That's why if you lose your liver, you lose your life. So be very nice to your liver. Okay. One of the things that people that drink a lot or abuse drugs don't realize is that if they compromise their liver function early in life, they get older, even if they're no longer using, if they need drugs to help them with things like infections or other disease conditions, sometimes we can't give them those drugs because the liver won't be able to process those drugs so that they can be cleaned from the blood by the kidneys. Okay, one of the other jobs of the liver is to take stuff that we ingest, drugs, right, and turn them into a form that we can pee out, right? And if you end up damaging your liver to the point where it can't do that anymore, we can't give you those medications because you'll die. Okay, so that's an unintended consequence of early drug and alcohol abuse. Okay, the liver is going to control your blood sugar levels. All right, it will reduce your blood sugar levels when it's under the influence of a hormone called insulin. Okay, as it performs a reaction called glycogenesis, which just means to make new sugar. Okay, and then when the blood sugar levels fall, glucagon will tell the liver to break down that glycogen and release the sugar into the blood, and that's called glycogenolysis. Okay, so critical, right? That's why if you don't have a liver and you can't control your blood sugar, that's going to contribute to your death. Okay, Other functions, it makes something called urea from the nitrogen in our diet, okay? And the urea ends up getting peed out in the urinary system. The urea is toxic, as is the ammonia that comes from the nitrogen that we consume, most of which is in the protein part of our diet, okay? And if we didn't pee it out, we would end up screwing up the body's pH to the point where we would die, okay? It makes bile, and we've talked about the job of bile, which is to emulsify fat, okay, so that it's easier to chemically break down. And we've talked about hepatitis and cirrhosis, okay, and the dangers that those represent. Anything that ends in itis just means inflammation of, okay. Hepato just means referring to the liver, right? So hepatitis is inflammation of the liver. We've talked about jaundice, okay. It's a function of the liver not clearing the bilirubin very well, okay? And that's why it usually is going to accompany liver disease, okay? And we talked about the gallbladder, okay? You don't need to know the piping of the gallbladder. Just know that the gallbladder gets bile from the liver and stores it and concentrates it and then uses that to emulsify the fat in your diet, okay? And like I said, sometimes when the bile sits too long, it forms gallstones, and that causes serious problems in the digestive system, okay? So those are your gallstones down there, and that's the obstructive jaundice, okay? Chemical digestion of our nutrients is carried out by enzymes that break down polymers using water, and those are called hydrolytic enzymes, and they have a pH at which they work best, okay? Carbohydrates are broken down in the oral cavity by salivary amylase and by pancreatic amylase in the small intestine, okay? And the idea is to eventually produce monosaccharides from those complex carbohydrates so that we can absorb them into the blood across the lining of the digestive system, okay? The enzymes that line the intestine finish the job, okay? Breaking down disaccharides into monosaccharides, and then that gets picked up by the blood, okay? So you can see basically what goes on here. Here comes the starch from your stomach. Amylase cuts it into smaller pieces, and then the enzymes on the lining of the intestine cut it into even smaller pieces, and then we end up in the blood, okay? There are enzymes that break down protein. They're just collectively called proteases, and that's all you need to know. There are proteases that are produced in the stomach, and there are proteases that are produced by the pancreas. And what they do is they chop the proteins into smaller and smaller polypeptide chains so that we can eventually absorb them as amino acids into the bloodstream, okay? And so there's the action, right? The protein comes in from the stomach, the pancreatic proteases bust them into smaller pieces, and then the enzymes that are along the intestine finish the job, and then we dump it right into the bloodstream, okay? Fats are a little different. Fats have to be emulsified by bile made by the liver and stored in the gallbladder. That happens in the first part of the small intestine. Then the pancreatic lipase continues the job of the breakdown of fat into glycerol and fatty acids. And then instead of going into the blood, they go into the lymphatic system, where they end up eventually entering the bloodstream in a blood vessel called the subclavian vein, which is up next to your shoulder, okay? And from there, they'll head to the liver. As we age, the function of the digestive system is going to decline, okay? You're going to have more GI disorders simply because you've been using it all your life. And the rate of replacement of the lining of the intestine and the entire digestive tract is going to slow. So it's tougher for you to do the enzyme activity that breaks down your nutrients. That's one of the reasons why you eat smaller meals. In addition, your taste buds and your olfactory receptors in your nasal cavity, the ones that provide your sense of smell, they die off, okay? Because they're not being made as quickly as they're being destroyed. And so food loses its flavor, And so everything starts to taste like wallpaper paste. And so eating is less fun. Okay. You make less saliva. So you end up with more cavities and more gum disease. So periodontitis is a risk. Esophageal and hiatal hernia result from the fact that the muscles that surround the digestive system weaken, okay? And the result is that you can get internal organs that bulge through walls of muscle, okay? A hiatal hernia is basically where the stomach sort of pops up into your chest through an opening in the diaphragm called the hiatus, and that's what the esophagus passes through. And that causes heartburn and emesis and all kinds of problems. We have to correct that surgically. GERD, we've talked about, and why that's more likely as you get older is because the muscle that closes the door into the stomach gets weak, and so the stomach secretions are more likely to reflux back into the esophagus and damage it. Peristalsis slows down, so it takes longer for you to process a meal, and you're more likely to get peptic ulcers if you're susceptible to them because of the time that the bacteria spends in the digestive system, basically attaching itself to the lining of the stomach. You can get diverticulosis and constipation because the muscle mass in the digestive system declines. You're not getting enough fiber in your diet. That can contribute to it. The liver will shrink, and that's just because everything shrinks as we get older, pretty much, because the rate at which we make new tissue is going to slow compared to the rate at which it gets destroyed. You end up more likely having gallstones. There's more likelihood of cancer, all right? And the reason for that is that the immune system is not working as well as it should. And so cancer, which happens every day inside your body, some of it slips past the immune system and can start to set up shop in other areas of the body. Hemorrhoids are a risk because of the constipation, okay? And then sometimes you can have incontinence as well, where basically you're having mass movements involuntarily. And that's due, again, to weakness in the muscle along the digestive system. The digestive system is part of the endocrine system as well. The nutrients there are used for energy, growth, and repair. The vitamins are used as tools by enzymes to carry out the production of energy and the use of building blocks, just like the minerals are, okay? The last part of this deals with nutrition, okay? So I'm not going to go through this because we're actually going to cover this a little bit later on in the course, but it kind of summarizes everything we're going to talk about in the course, okay? It's got useful material in it. I'm going to leave it for you to look at, okay? We can talk about, though, some eating disorders, okay? Obesity, right? That's your body weight 20% or more above the ideal for a person's weight. In the US, 36% of women and 32% of men are overweight. Why? Basically, you're eating more calories than you're burning, okay? What contributes to this? Lower activity levels, higher consumption of calories. And then there are also, in some cases, hormonal conditions that can lead to obesity, such as an underactive thyroid would be one example, okay? How do you deal with this? It's simple to understand, but it's hard to do. It's eat fewer calories and exercise more, okay? It's really not magic, but it's hard to do on a regular basis, okay? Usually we use something called the BMI, or body mass index, to determine whether or not you're overweight. That's a little outdated because if you've got a lot of muscle on your body, you could be technically overweight by the BMI, but be very healthy, okay? So generally what we do is we take percentage of body fat as a measurement of how healthy or unhealthy you are. Bulimia is a condition, it's a psychological condition in which you eat large amounts of food and then induce either diarrhea or vomiting in order not to get the calorie payoff from the food, okay? Why does this happen? There's a large number of theories on that. How do we treat it? Counseling, okay? The damage here is that if you're inducing vomiting, emesis, the stomach acids are going to erode your esophagus and your teeth, and you're going to get more likely cavities and tooth extraction and gum damage, and you may end up with esophageal varices or a Barrett's esophagus or even a hole in your esophagus, okay? Same thing can happen to your stomach. Anorexia is just you're not eating, okay? And basically, psychological factor is you don't want to gain any weight. Body image plays a big role here. What do you end up with when you starve yourself? Low blood pressure, and irregular heartbeat, constipation, chilliness because you can't thermoregulate properly. Your bone density goes down, so you're more likely to break your bones. Menstruation stops in women. Your skin dries up, and of course, the end result of this is you die. Okay. Why does this happen? Again, it's psychological. What's the treatment? Counseling and a balanced diet. This is a big thing among women, although men have, a lot of men have anorexia as well. Bottom line, if you don't take in your energy and your building blocks, the body can't maintain itself, okay? So anorexia and bulimia, this is the way to recognize them. These are the main symptoms, and the treatments are just as we've described, okay? Again, bottom line is to maintain a healthy body weight and normal function, you need to eat as many calories as you burn, okay? Now, it doesn't mean you have to restrict yourself to 2,000 calories a day, but it just means that if you eat more, you exercise more, okay? And exercise should be balanced. It should be endurance exercise as well as resistance exercise. Endurance exercise are things like jogging and running, jumping jacks, aerobics, okay? Resistance exercise is lifting weight, either your own body weight or free weights or a Nautilus machine of some kind, okay? You want to do a little bit of both every day in order to maintain not only cardiovascular health, but also overall muscle strength, right? And muscle health. So with that, we bump out. That's all I've got for today. I will post this lecture today so that you can access it. And as I said, you've got the notes. Remember that the exam isn't due until Sunday, 11:59. Make sure and take it and get it in. If you have any problems, let me know, okay? And if you have any questions, let me know. Make sure, if you're still confused on chemistry, that you watch those 2 links that I sent you. They're very, very good in terms of explaining the chemistry concepts, and that makes it easier for you to understand a lot of the rest of what we've done in the course, okay? So with that, does anybody have any questions before we bump out?
Yeah.
Okay?
Did you send the homework for the digestion? Because I can't find it.
I'll send that after we bump out.
Okay.
Anything else?
Yes. What is this paper that I printed out? This chapter 2, ingestion, digestion, absorption.
Yeah, those are the notes for today's lecture.
Okay, these just notes.
Those are notes, right? And so the idea with those is that as you listen to the lecture, you just type in the important stuff in the little forms on the side, okay? And if you do that in Adobe Acrobat Reader, you can do that right on your computer.
Okay.
Okay. So I send those with every lecture, right? Before we talk about something in the PowerPoint, I'm always going to shoot you the notes first so that you can follow along. Okay.
Okay.
All right. Anything else?
And you said the exam is due when?
Which stuff is due what?
The exam is Sunday.
Sunday night. The test exam is due Sunday night. Okay. And then any homework is going to be due by next Thursday.
All right.
We good?
So whoever comes
Have
to
you
the
posted the test?
Come again?
The test is due. We got till
Sunday
Sunday to
night.
take the exam.
Sunday night, and it's on the website. Okay.
Mhm.
Okay.
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 All right, y'all.
All right, bye.
Yeah.
All right.
Contact me if you got any questions.
Okay.
I'll see y'all 4:30.
Yep.
4:30.